Hello, I'd like to tell you about... Oh, didn't expect that.
Hey, sudden cardiac arrest occurs when the heart stops beating properly. Sudden cardiac arrest is an electrical problem caused by an abnormality in the heart's electrical system. The heart's pumping action is disrupted, and the heart can't pump blood to the brain, lungs, and other organs. Seconds later, the victim collapses suddenly, appears lifeless, and is not breathing, or is abnormally gasping for air. You may see several seconds of seizure-like symptoms.
Hello?
Not true. Cardiac arrest can happen to anyone, anywhere, anytime. Although more commonly seen in those who have heart disease, cardiac arrest can also strike those with no history of heart problems at all, and can be caused by recreational drug use, electrocution, or even a sudden blow to the chest. Sudden cardiac arrest is the leading cause of death in many countries, and its survival rate is less than 1% worldwide. No, cardiac arrest is not the same as a heart attack. Think of a heart attack as a plumbing problem. It occurs when blood flow to the heart is blocked. Victims of a heart attack are still conscious and may complain about symptoms such as shortness of breath or discomfort in the chest. In contrast, cardiac arrest victims need help right away. Every minute without help means the chances of survival drops by 7 to 10%. That leaves only a golden survival window of only 10 precious minutes. So better get moving. The odds of survival depends a lot on if the victims receive immediate CPR and are treated quickly with automated external defibrillators, or AEDs. It is important to know how to perform CPR and use an AED. It could save the life of a friend, family member, or loved one. When cardiac arrest occurs, oxygen-rich blood stops flowing to the brain, lungs, and the rest of the body. Brain cells begin to die within minutes, and sadly, death soon follows. Cardiopulmonary resuscitation, or CPR, a life-saving technique, should be performed immediately, but chest compressions only. The purpose of CPR is to help keep oxygenated blood flowing around the body until medical help arrives. Good CPR can radically improve the chances of survival up to 6 times. Remember, CPR provides oxygen-rich blood to the brain, heart, and vital organs in order to keep it functioning properly. And don't worry about causing any more harm to the victim. The chances that the victim will survive cardiac arrest without compressions is nearly 0. Now here's how to perform chest compressions. Get down on your knees. Place the heel of one hand in the center of the chest. Place and interlace your other hand on top. Position your shoulders directly above your hands, keeping your arms nice and straight. Now push hard and push fast. Based on the latest 2015 International Resuscitation Guidelines, you will need to do this to ensure you are performing good CPR. Compress at a depth of 5 to 6 centimeters. Compress at a rate of 100 to 120 compressions per minute. Pause for no longer than 10 seconds. Ensure full chest recoil. CPR alone won't restart a heart. It keeps the victim alive until an AED and medical help arrives. Most importantly, an AED should be used as quickly as possible. Survival can depend on it. An AED, or automated external defibrillator, is a portable, user-friendly medical device used to treat someone in cardiac arrest. It's designed for use by lay rescuers without medical supervision. That's you. An AED will automatically diagnose abnormal electrical heart activity that causes cardiac arrest. An AED treats cardiac arrest by delivering an electric shock to the heart called defibrillation. This stops the abnormal electrical heart activity and allows a chance for the heart to function normally. The AED analyzes the heart's electrical activity through electrode pads applied to the chest. Defibrillation provided by an AED is highly accurate and effective, but you have to act quickly. Since most of us, fortunately, don't run into these situations every day, modern AEDs have CPR feedback technology and are recommended by the latest international resuscitation guidelines. They provide real-time feedback for depth and rate of chest compressions, which allows rescuers to know how well they're performing chest compressions. It guides rescuers with prompts and a real-time bar gauge to the recommended depth and rate of chest compressions set by the international resuscitation guidelines. Remember, doing CPR and using an AED are both critical in a sudden cardiac arrest.
Nice day for a walk in the park.
Would you know what to do if someone suddenly collapsed in front of you? Helping to save a life may be easier than you think. If you see a teen or an adult suddenly collapse, it's important to respond fast. Running away and ignoring it is not an answer. Here's the sequence to respond to a sudden cardiac arrest collapse. As with all first aid situations, you need to assess the risk to your personal safety first, and the safety of the casualty second. If the victim appears unconscious, shake or tap the victim's shoulders and shout,
Hello, are you okay?
If we get no response, the victim is unconscious and we send for help.
Call an ambulance. Get the AED.
Open the victim's airway by tilting their head back and lifting their chin. If the victim is not breathing or even gasping, start chest compressions right away. When the AED arrives, allow your second rescuer to prepare the AED while you continue compressions, and follow the instructions from the AED when it's ready.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
Remember to remove the victim's clothes to expose his or her bare chest before attaching the electrode pads. Tear open the electrode pack and unfold the electrode pads. Once the pads are applied, the AED will automatically analyze the victim's heart rhythm. You should not touch the victim at this point.
Shock advised.
The AED will advise you to perform CPR immediately.
Push harder. Good compressions. Continue compressions.
Continue CPR and using the AED, following its instructions until help arrives. Your actions can help save a life, including the life of someone you know.